want to record this video as I recently completed reading the book The Death of Cancer by Dr. Vincent Devita. Finished the book about 3 weeks ago, perhaps. There's not a day that goes by that I don't think about it. Dr. Devita was a true pioneer in cancer research and cancer care. And as I think about what he has done, about the work he did that led to the cure of Hodgkin's disease, but then how that affected how we thought about cancer and how we thought about cancer treatments, and the work that others have done in the field that seems to be so aligned with his philosophy. Dr. Friedreich, Dr. Bartloghi. I think there are so many critical lessons to be learned from their philosophy and from their attitude. Every day you walk into an office where you're going to be seeing a patient. You're talking to a patient and their families. If you want to do good service, you have two options. You have the option of doing good enough. You have the option of doing standard, and you have the option of providing them with, let's call it average care. You have, on the other hand, the option of doing the best you can. You have the option of thinking of that encounter as a final exam. It's a way by which you will be a very strong advocate to make sure your patients get the best there is. That was the way of Dr. Devita. I personally align with that. And I think the opportunity that we are provided when we are entrusted by patients for their care, for cancer, and the difference that subtle, slightly different approaches might make for their long-term outcome, whether you think maybe a clinical trial, maybe an added test, maybe a slightly different way of doing things. Certainly less on the nihilism and more on fighting for them. And doing so, of course, guided because it is their choice, because it is their preference, because that's what they want to do, and to do so safely. But there's subtle differences that I think make a world of a difference for the outcomes of cancer patients. So I want you to think about this, and I think that subtlety makes a world of a difference for cancer patients. Thank you for listening to this.